Now, more than 250 patients a week may have died needlessly due to long waits in accident and emergency. This is according to a new study by the Royal College of Emergency Medicine. They say long waiting times have been blamed on insufficient funding, resulting in too few staff and quite simply not enough beds. Joining us live is NHS GP Dr Philippa Kay and co-chair of Keep Our NHS Public and retired consultant paediatrician John Puntis. Thank you both so much. And Philippa, just tell us what's been found in this research. Effectively, people going to A&E, if they're not seen, it seems, within that sort of initial window of the 4-hour target, people are being left in quite critical conditions for far too long.
It's not actually about how quickly they're seen. It's about how quickly they are then moved on from the department, be that discharged or moved on to a bed. And when we look at the targets, there is a target to be seen, admitted or discharged, processed essentially within 4 hours, which hasn't been met. We're meeting at about 70% of the time. But there then isn't another target. There isn't an 8-hour or a 12-hour target to then look at afterwards. And what this study has found is that for the longer that you're in A&E, the more likely that there can be a problem, and that there is one excess death for every 72 patients that spend 8 to 12 hours in A&E. And what I mean by excess death is a death that could have been prevented. So unfortunately, people will pass away due to cancer, heart disease, stroke, whatever it may be. But these are potentially preventable deaths. And even more important than the numbers that we've just said are the fact that they are likely to be an underestimate, because it hasn't counted the people who are in the back of an ambulance for however long before they then get to A&E. So unfortunately, the number may be higher than this study suggests.
So Philippa, why is that happening? You'd assume you're at accident and emergency. The clue is in the title, this is an emergency. What is going wrong, which means those people aren't being seen, aren't being discharged, aren't being moved on to the right place?
Let's be clear in the first instance that my colleagues in A&E are doing a fantastic job, and they deal with accidents and emergencies all day, every day, and they are absolutely doing the best that they can. There are lots and lots of reasons why this is happening, and everything from people not being able to leave hospital because social care and care in the community hasn't been set up or is taking too long to set up, to lots of people coming to A&E that potentially could have gone to see a GP, a pharmacist, gone to a walk-in centre or an urgent care centre or a minor injuries unit. There are lots and lots of reasons why this might be happening. Again, it's important to say that if you do have an accident or it is an emergency like a heart attack or chest pain or whatever it may be, please go. You still need to go. You still will be seen. But A&E is not designed for continuing care. It's designed for emergency care, assessment and moving on. And it's very difficult to look after patients as well as we want to look after them when they're in corridors for much longer than no one should ever really be looked after in a corridor at all.
Yeah, of course. John, listening to that, quite simply put, people are dying who shouldn't be dying, who've come to hospital to get treatment, urgent emergency treatment. What's your evaluation of what needs to change extremely swiftly, having there already been an acknowledgement from the Prime Minister in February this year that they'd not done enough to remedy the situation, to stop what's happening? And do you actually think it's practically possible to do that?
Well, I think there are ways of improving the situation, but as Philippa said, this is a multifactorial problem, and I would see A&E as being like the canary in the mine. It's actually telling you about systemic failings in the NHS rather than the problems just being located to A&E. And the problem, as we've heard, is that you have a patient who's been assessed, they're judged sufficiently sick to require admission, and then there's no bed for them. A bed has to be made, a bed has to be found. And the fact that they wait many hours relates to not having enough beds and not having enough staff. We've actually halved the number of beds in the NHS over the past 30 years, and just over the past 14 years, we've reduced by about 13,000 beds. And of course, we have something like 120,000 vacancies. Now, on wards, you'll find about 1 in 7 patients are fit enough to go home, except there isn't any community or social care support in place to enable them to be discharged. And this is why bed occupancy rates, which shouldn't really be above 85%, are commonly running now at over 95%. So unfortunately, there's no quick fixes. We need more staff. We do need more beds. There should be urgent investment in primary care, in social care, and in ambulance services, and actually in mental health, because that's another really important critical area. So I think investment in those areas quickly and a big cash pay down to the NHS needs to be made to enable it to make some of the changes which are absolutely crucial, as well, of course, as having a much more thought out overall long-term plan for the NHS, thinking about how it copes with a population that's increased by 5 million, with a huge increase in the number of the elderly, those with chronic sickness, people with mental health problems. We have to invest more in the NHS to make it work properly. There's no getting away from that. We spend 18% less per capita than comparable European countries. And as a consequence, we get the services that are second rate.
As this story lays out so clearly, Philippa, John said the service is clearly stretched, needs this big sort of cash investment. Of sort of the suggestions he's put forward to say, we need this sort of multi-layered approach to try and fix this. Do you have confidence that those things are in play that's going to secure the NHS for the future in a way that we don't see stories like this?
I wish that I did is used in politics, and I think that we will be hearing lots of promises being made about the NHS as we come up to a general election. It needs money, but it could take all the money in the world, but we still need to recruit and we need to retain staff. There are lots of things that we need to do which aren't solely about money, and we need to look at social care. And actually, when you separate social care and health care, they're impossible to separate, but when they are separated, it causes problems. But I think that we do have a wonderful system that is doing its best. And that actually this is an opportunity for everybody who's watching going, oh, I'm really worried, what can I do? Well, attend your screening programs. Make sure that you don't run out of medicine, that you shouldn't be pitching up to A&E because you've run out of your pills. And, and we hear stories like this all the time of people pitching up to A&E when they have a sore throat. Now, there are other places that you can go to, and I'm not saying at all that all the responsibility should be on the patient, because clearly, absolutely, it should not be. But there are some things that we can do. And for people who are worrying, because that's what happens when you see a headline like this, and a headline last week about people being dissatisfied with the NHS, and people worry very much. But there are some things that they can do to help. But I think that anybody in politics needs to be thinking across the board, as opposed to just thinking, well, I'll put more money into A&E, or I'll just put more money into one thing. We need to be thinking laterally and connecting the dots to see how we can help.
Philippa, John, thank you both so much on what is really grim reading this morning. Long waits in accident and emergency. It's estimated that's resulting in unnecessary death of 250 people a week.